So you're turning 65 and you're starting the Medicare journey, and you know that you need to start looking for health insurance. You're going to retire soon, and you gotta replace the health insurance that you've had with your employer forever, and we call that Medicare. Now, you've also probably done some research and realized that there's a couple different directions you can go with your health insurance. I can go with Medicare Advantage, or I can go Medicare Supplement, whatever that looks like. That's great. But what I want to talk about in this video is what else you should consider. What else you should consider when it comes to your, I guess, your Medicare or retirement planning, whatever you want to call that. There's some things you should consider because there are some gaps to Medicare that you need to know about that even the primary types of Medicare plans won't cover, or what we call core options won't cover. Now, before I jump into this information, I want to let you know that our agents are highly trained, and everything you hear about in this video, they are able to help you with. So please remember that when you decide you want to give us a call and make a decision for your Medicare plans and your other plans, follow the information in the description of the video below, and we'll have an agent talking to you in no time about your options. So what else should I consider? What else should I consider? Well, let's start with this. We know that original Medicare, or Medicare, original Medicare is going to be made up of two parts, and that is Part A and B of Medicare, which is hospital and medical. And to be quite frank with you, hospital Part A is what it sounds like. It is hospital coverage. That is your room and board. If I have to stay in the hospital, or if I have to go to a skilled nursing facility, Part A is what is going to cover that for me. And I do have out-of-pocket costs with that, and we'll talk about that in a second. But I also have Part B, which is going to be medical, meaning that it covers all outpatient services. So hospital is going to be inpatient. Part B, medical, is going to be outpatient. And those are my two health insurances that will be on my Medicare card. And that is health insurance that I can go see doctors or medical professionals with, stay at the hospital, and it will cover those services for me. It will cover those services for me. Then I also have Medicare Advantage, which is a Medicare replacement plan, a primary Medicare plan. It's a replacement plan. It would replace my original Medicare, and now my Medicare coverage would be through a private company rather than original Medicare. But this is still going to cover hospital and medical. And then I have Part D, which is prescription drug coverage. If I were to stay on original Medicare, if I want to keep my original Medicare so I can see my doctors and I don't have to worry about prior authorizations, I would have to get a prescription drug plan as well. And a lot of people know that already. A lot of people have already done their research, and they know that they need a prescription drug plan. They know that they need a Medicare Supplement, or they need to go Medicare Advantage. Whatever that is, they've made that decision, but they haven't quite dived in or looked at or researched what else they should consider, because they don't know what else they should consider. They just know the things that they've heard and the things that they've looked into. So we're going to talk about that. And I like to use an illustration called your Medicare House. I used to call this the retirement home, but my customers didn't like that too much. So I started to call it the Medicare House. This is my Medicare House, and this is how we plan for health insurance and other things past retirement. And I want you to imagine it like this. This is the Medicare House. The foundation of the home is Part A and B. This is your foundation. This is your health insurance. This is the primary medical coverage that you have. When you go on to Medicare, you have A and B, which is your hospital and medical. This is your major medical coverage. And this is the foundation of your home. And you have to have a foundation of your home to build on. And a lot of people know that I have to go next step after that, and that is get a Medicare Supplement. That's going to be the floor that we build our foundation on. So if you're going to go plan F, G, or N, whatever that looks like, that's going to be the floor of the house, and we're going to get that put in place so that we avoid all the gaps of that original Medicare coverage. Now, these two things together make up great health insurance. It's a primary and a secondary, and they do a great job of taking care of you, but there's some things that aren't covered. And the one thing that's not covered is a drug plan, because Medicare supplements aren't going to cover anything that Medicare doesn't cover. Medicare does not cover drugs, doesn't cover your pharmacy, so your Medicare supplement will not cover that. So you'll need to get a drug plan as well. And a lot of people are familiar with that. If you're not, here you go, now you know. But there are a lot of people who already know this. They've done this research. What I want to focus on are the next three parts of our house, the things that you haven't considered yet. The things that you haven't considered yet. And the first one is this: dental vision, and hearing. Medicare does not cover dental, vision, hearing. It doesn't cover dental, vision, hearing, which means my Medicare supplement wouldn't either. So I have to get some kind of coverage for dental, vision, hearing if I want those to be covered. If I want my dental, vision, hearing, if that's important to me and I want it to be covered and I don't want to spend a lot of money out of my own pocket, I'm going to have to get some kind of standalone plan. I could enroll into a Medicare Advantage plan, but if I do that, I'm giving up my original Medicare, going to a replacement plan, and I would be subject to networks and prior authorizations, things like that. And I don't want to do that necessarily. Maybe you do, that's fine, we can have that conversation, but if I want original Medicare, I don't want to do that. What I want to do is I want to get a standalone dental, vision, hearing plan, and the good news is our agents are contracted and educated and trained on how to get you in a plan that's going to take care of your dental, vision, hearing needs. Next, what I would have to consider is I would have to consider my retirement accounts. Most people, when they're thinking of Medicare, they get so caught up on the health insurance side, they don't even stop to consider, oh, wait, I have a 401k, or I have a Roth IRA, or whatever. I have some kind of retirement account that needs to roll over. It's matured, and I've got to roll that over. A lot of people don't think about those things. And this is why we like to be a one-stop shop to talk about these things and to get those put in place. And so we like to talk about retirement accounts in our Medicare House, if you will. We like to talk about things like retirement accounts so that we can get that rolled over and get you in a spot that's going to take care of you in that regard as well. And then the roof of my house, if you will, this is the ceiling. I got my walls, my ceiling, whatever you want to call it. I have these pieces put together to build a house for you. But the roof, keeping the storms out, is going to be critical illness. Things like cancer, heart attack, and stroke. A lot of people think that once I get my health insurance put in place that I'm good. I don't have to worry about any out-of-pocket costs when it comes to inpatient or outpatient. However, there are max out-of-pockets on your drug coverage that we want to take care of. Your Medicare supplement is going to do a great job of taking care of things like cancer, heart attack, and stroke when it comes to hospital medical. But your drug plan does have a maximum out-of-pocket. And you could be out of pocket for those expensive cancer, heart attack, and stroke costs. So we like to put this into our house, if you will, for our customers so that they can avoid those costs on their own. And this is going to be designed to pay for, we like to design it to pay for your max out of pocket on drugs for 4.5 years. And that maximum out of pocket is a $2,100 yearly max out of pocket that was put in place by the Inflation Reduction Act. And so now you're subject to pay that every year on your prescriptions. We like to put that in place to take care of those out-of-pocket costs so you don't have to. So what you're seeing here is you have the foundation of your home, you have the floor of your home, the walls, then you have maybe the wallpaper, you got your ceiling, and then you have your roof. We have a complete Medicare house by talking about all these things. So many people come to our office or they call us and they say, I like to ask them, what are you losing with your employer when you retire? They say, oh, well, health insurance. And they may remember to bring up something like, maybe they remember to bring up dental, vision, hearing. A lot of times they don't. And so we have to remind them, these are the things you're losing. Health insurance, drug coverage, you're losing dental, vision, hearing. You have a retirement account that needs to be looked at. You have critical illness protection you need to look at. And then another one, if you will, is life insurance. We can make that the chimney because we have to build that later, but I can't have that same conversation at the same time. But life insurance, those are things that I'm losing too. So these are things that you need to consider that Medicare doesn't cover and you are losing in your retirement. So you need to talk about these things. And the good news is we are the ones who created the Medicare House. We're the ones that designed this, and we build these packages for our customers all the time so that they can be protected on all sides of retirement, not just their Medicare health insurance. Listen, Medicare is a journey. Turning 65 is a journey. It's a complicated one. But the good news is we are a compass and we can navigate you through that. So please follow the information in the description of the video below to get in touch with one of our agents today so that we can get you your Medicare House.